that there was a patient that he saw, a 20-year-old, that had a clot in the middle cerebral artery, which is the most important artery of the brain. And of course, this is a very worrisome scenario. You can imagine a 20-year-old with an occlusion of the middle cerebral artery, which is the main artery of the brain. We're looking to a chance of death or disability in the 80-85%. So it is extremely worrisome. The patient was in an outside hospital, and therefore he advised the physicians taking care of her to transfer the patient immediately to Baptist Hospital, because when someone has an occlusion, we have a clot in one of the arteries of the brain, there's a very effective treatment that we can do nowadays, and it's called mechanical thrombectomy. So we can access the artery of the brain from the inside, so to speak, and then remove the clot. Once you remove the clot, remove the occlusion, the blockage of the flow of the brain, the patient do extremely well. So the patient was transported very quickly to our center. We took her straight to the angiographic room to perform the operation. And the patient was doing okay at the time, was fluctuating, like often happening. These patients are very young. The brain compensates, which is of course good for her. So she really have a strong deficit, but if you don't do anything, these patients they do extremely poorly. So was able to go up into the middle cerebral artery of the brain from the internal, like traveling a small catheter all the way up, and I was able to remove the clot. The clot was actually very dense, was very well constructed. So we thought it was probably coming from the heart at a certain point. And we were able to remove the clot, to restore blood flow. The patient woke up from anesthesia. She was doing extremely well. She had very mild numbness on one side, very difficulty speaking, but then she recovered immediately. And then a few hours later, she was perfectly normal, like nothing ever happened.
Yeah, and I know the doctor stressed at first, and not to mention she's only 20 years old, and didn't seem to have any underlying health issues, that her symptoms were not quite as severe as you might find in an ischemic attack, or this situation. So he was afraid that she would fall through the cracks, and nobody would, she wouldn't be taken care of. So, did you have that feeling as well?
Yes, of course, there's a risk. Young patients are good because the brain can hang in there, can compensate for a terrible situation of lack of blood flow. But of course, if the clinicians doesn't recognize the symptoms promptly, doesn't recognize that this patient in few hours might deteriorate very quickly and get worse very quickly, we're looking to a terrible scenario. So it's extremely important to recognize that young patients can withstand ischemia for a long period of time, but if you don't remove the obstruction of the artery, they do very poorly, just like the other patients.
Okay. And are you aware of any other risk factors that she have, or I don't know, high blood pressure?
So we didn't have, we're not aware. She underwent a full workup, and they discovered that she had a condition called patent foramen ovale, which is a communication between the two chambers of the heart. She was born with that, and probably we were thinking there was a clot traveling from her legs all the way through the heart, and then was arrived into her brain vessels.
Okay, now he did mention, Dr. Abrams wasn't sure about that, but he did mention possibility of that genetic defect. Can you tell me what it is called, the reference to that genetic defect in the heart? Or?
It's called patent foramen ovale. It's not, I don't think it's genetic, it's acquired.
Oh, okay, all right.
People are born with it.
Okay.
Now, there's a long list of genetic diseases that can cause something we call hypercoagulable state. So genetically, some patients are more likely to develop clogging of the artery anywhere, especially in the brain. So, but she didn't have that. What we found that she has this communication between the two chambers on the heart. She's probably born with that.
Okay. And she defined, and can you tell me how long the thrombectomy takes? Roughly how long the mechanical?
So because the brain doesn't last very long in condition of lack of oxygen, you have to be very fast. And so we can do this procedure very quickly, probably maybe 15, 20 minutes, the whole procedure. In her case in particular, because she's younger, vessels are very, very straight and we are able to do the procedure very effective. I would say probably maybe 20 minutes or so.
Wow. Okay.
Of course, you have to be extremely careful, because of course it's a very dangerous situation. If you perforate, if you go through the artery, the patients have horrible outcomes. Of course, you have to be extremely careful. It takes a lot of training and experience to perform this procedure effectively, especially young patients.
Now, we heard that she's having I don't know, Gabby heard that she's having a follow-up procedure of some sort. Do you know anything about that, or she's?
Oh, she will have. Probably she have the. So how do you treat her condition? There's a procedure that they can perform, and they perform it here, in which I don't know if they're going to do an open surgery or they're going to do an endovascular procedure, but you can basically go and basically seal the hole between the two chambers of the heart, so that doesn't happen again.
Oh, okay. And it is a minimally invasive procedure, or?
I'm not sure what they're going to do in her case. They can be done in two ways. Can be done open surgery, but most commonly nowadays they can do it also. The cardiologists do it. What we do,
right.
We use this endovascular approach. So we go from the femoral artery, travel all the way in this case into the heart, and they use a device that plug the hole.
And is that a outpatient? Is it a procedure that requires hospitalization? Do you know?
Yes, I mean afterward, because of the hospital course, to make sure.
Okay.
Just be sure the patient is doing well. It's basically heart surgery. Like my procedure is brain surgery. This is heart surgery, so the patient has to be
right.
Has to be at least typically one day in the hospital just for observation.
Okay. So yeah, because that's why she had to postpone her interview. So that's important. Anything? Oh, were you involved in the FaceTiming with the parents at one point with Miss McClure before she had her thrombectomy, or do you remember?
I talked to them. I talked to them before and after. I told to them that I told them what she was having and told it was a very dangerous situation. It could potentially result in a death or permanent disability of their daughter if you don't intervene. And of course, a procedure there are possible complications, but of course here we do so many. So in high volume center, the complications are much less than in low volume center. So in centers where we do many of this procedure, we do this procedure almost every day here. So the risks are low, but there are risks.
And I would imagine how any parents could feel frightened.
Oh yeah, she was of course extremely upset because also she was in Texas.
Right.
And then after, of course, as soon as the procedure was done, I called her and I told her that we were able to remove the clot safely, and then she was wide awake and she was doing fantastic. So they were super happy, very happy.
And did you use Face? I mean, was there a video? Was it a video call? Just for specifics on. Do you remember?
No, I talked to them on the phone.
Oh, okay. And I don't know if with your experience, are you getting more younger patients with this type of ischemic stroke? I know it's a trend. I mean, the rates seem to be going higher among younger people for whatever reason. Nobody seems to. Are you seeing?
So it's still not common in young patients, but we see more. I'm not sure if this is an actual phenomenon, because since we do this procedure effectively, then the patients are referred more to us. During the COVID, in the COVID days, now we're hopefully coming out of this COVID situation. COVID definitely affects younger patients more than older patients when it comes to stroke. So patients with COVID can have a stroke, and those patients are younger than the patient we typically do. So of course, when you see a young patient with a stroke, especially nowadays, you're always worried if it's a COVID-related type of situation. She was COVID negative, however.
Okay, that was my next question. She was COVID negative, and to your knowledge, she never had COVID, or do you know?
Oh. No, I don't think so. No.
Okay, all right.
Not to knowledge.
Because I know that's the neurological impact of COVID is still being studied. There's quite a bit of different neurological impacts we're looking at. So
we just published a paper, a review of over 1,000 cases,
right.
And of those, 125 are from the States and 9, I think, are from us. So we published on this, so we know this condition very well. So it's apparently stroke in COVID patient. I can tell you briefly the summary article. So happens probably in estimated to be 1.8 to 2% of patients. So thank God it's not common, but it does happen. These are the good news. The bad news is that mortality for this patient is very high, because especially if they have a pneumonia, it's very difficult to save them from a stroke. It's not your typical stroke patient that we can treat effectively with the techniques that we have nowadays. Unfortunately, it's bad news. It's someone with COVID, especially COVID pneumonia, has a stroke.
Right.
Mortality is about 5 times higher than typical.
And this is part of a paper that was published, so you all contributed to, or?
Yes, I'm an author.
I could send you the paper actually, because we're gonna do a post on it for social for MNI. So I could send you the paper if
please,
you'd like.
yeah, all right.
Yeah.
Yeah. Oh, maybe
I'll send it to him.
All right, fantastic.
Yeah, that's the paper. Yeah.
Oh, great.
And then I have a question, if you don't mind, Dr. Infante. We did a patient testimonial recently with Dr. DeBus, and one of his patients that was a COVID patient that had a stroke later on, like I think a month later. And Dr. DeBus told me at the moment that I think he had only seen 9 people at Baptist Hospital who had strokes and COVIDs, and I think he was the only one who has had a good outcome. I don't know if that's still accurate.
Yes, it's accurate. 9 patients is the only one. I think because he had COVID before.
He did. He had COVID like a month or 2 before, and then he had the stroke.
Right, so that's why he made it. The patient will do very poorly, and in the paper is nicely described. If you have actual COVID pneumonia, so COVID pneumonia, horrible inflammatory state, cytokine storm that has been described, and they have a stroke. So these patients do awful. Patients who maybe had COVID before, or they have COVID, but they don't have pneumonia yet. They might have a good chance, but still mortality is higher. Right. But for those with COVID pneumonia and full-blown COVID infection and have a stroke, the mortality is extremely high.
Wow. Yeah, no, this gentleman was had mild COVID at 30 days prior, so I guess.
I didn't have pneumonia. Yeah. Right. All the 9 patients that we did, there are certain, most of them had pneumonia, or they had just had pneumonia, or they recovered from pneumonia. Okay. So they were bad. They're in bad condition. Some of them are very young too.
Anything else, Gabby?
No, I think that's it. I think we covered everything. Anything that we missed, Steve, or that you want him to repeat?
Yeah, if you have time, I want to re-ask a few of the questions because I need, for video, I'm going to need the answers a little bit shorter than what you gave to John. So if we can, I'm just going to kind of start from the beginning. So it shouldn't take as long since the answers need to be a little bit shorter for me. So to start, you got the call straight from Dr. Abrams, correct?
Yes.
Okay, so what was it that he said to you and that made it to make it such an emergent situation?
So Dr. Abrams told me there was a 20-year-old patient with a clot in the main artery of her brain called middle cerebral artery. This is an extremely worrisome situation because an occlusion of the middle cerebral artery, the main artery of the brain, carries 80-85% death or disability.
Okay, and then so when she came into you, you pretty much took her straight to do the procedure. Yeah. What was the procedure called? And
so the procedure is called mechanical thrombectomy. So with this procedure, we access the femoral artery in the groin area, and we travel with a small tube into the middle cerebral artery, which is the main artery of the brain. And with different devices, different tools, we remove the clot from the artery, and therefore we bring blood flow back to the brain.
Perfect. And so obviously it was successful. Can you speak a little bit about the success of the surgery?
So the procedure was successful, was performed very efficiently and very, very fast. And we removed this large piece of clot, thrombus. It was very, very hard. It was very, how can I say? So we were able to remove the clot from the middle cerebral artery effectively in maybe 15 to 20 minutes.
Perfect. And so after the fact now, what do you think her prognosis is?
So the prognosis is excellent because once the clot is removed and blood flow is restored and the patient wakes up from the anesthesia, she had a normal neurological evaluation. She had no deficit whatsoever. And she was kept under observation for 24 hours. So we know 24 hours are the most critical part. If they pass 24 hours, she's going to do very well.
And have you seen her since the surgery?
I saw her before she was discharged.
Okay. So obviously, I mean, that was pretty quick right after. So she was,
3 days later, yes.
so she was doing well at that time.
Perfect. Like nothing ever happened.
Good. And now, when you said, I mean, this is totally different. Dr. Abrams was saying that there's like the way that you get it out. There's like suction tools or other ways. How do you guys do it?
I thought you want to do in detail the procedure. So there's
Well, I mean, this is just totally different. I was just curious at this point.
So mechanical thrombectomy, I use different tools. One is called retrievable stent. It's basically a stent, so it's a tube mesh of metal that you can implant in the vessel, and you open the device and you retrieve it. As you retrieve it, this metal mesh grabs the clot and pull it out. Another technique is called aspiration thrombectomy. So we reach the artery large bore aspiration catheter, and that is almost the same size of the vessel, and then we turn and then we suction, and then we're able to suction the clot out. Another technique is combining both, so you do a suction plus grabbing the clot, and depends on the patient, depends on the type of the vessel the patient has. We choose one technique versus the other.
Okay. Is that something that's determined beforehand, or is that something that, like, when you're in there and you make the split decision, it's like, hey, let's do it this way? Or
there's some data in the literature. However, I think every patient is different. So I mean, the data makes sense because they give you overall guidelines. However, each patient is different, so we need to individualize the treatment to the patient, the type of vessel the patient has, the type of tortuosity. There are several factors that play a role, and then so you use of course your guidelines and your data, but then use your clinical experience to perform the procedure. Like any surgical procedure.
So for me, that's good. If there's anything else, I'll pull from the questions that were asked by John. For me, that's good.
I have one more quick question. I don't know if you were aware, but she's studying music at the University of Miami, and she's a singer. So her speech would have potentially been impaired if she had not gotten treatment, right?
Yes, she told me, and she likes aria operas, and so we discussed about Italian operas. She's actually pretty knowledgeable.
Yeah.
So yeah, of course, being unable to speak would be horrible for her. But we're not with the middle artery is occluded. You're not looking at just a speech. She'll probably paralyzed on the right side for the rest of her life, or most of the rest of her life, so disabled. So not just speech, is complete paralysis on one side, or death, because in young patients, the brain is very tight, so to speak. So they swell. It's horrible. No, 85% mortality. We're talking about death or disability. I mean, speech is important, obviously, but their stakes were much higher in her case.
And one more question, I think, from me, doctor, is her acquired condition that she's being treated for, the communication you said between the valves.
The
chambers, I'm sorry. That could have been or not necessarily contributed to the stroke.
No, I think most likely that's what happens. Because the two chambers, the right heart and the left heart, are separated by a wall, and this wall seals off during development of the heart. So in some patients, this wall doesn't seal off, so there's a communication. So any clots you form into the venous system can travel. Usually, might travel into the lungs and cause a small pulmonary infarction. But if there's an opening to the chamber that travels up into the brain and cause. You don't need much. I mean, the middle CV artery is about 2 millimeters. Okay. So a 2 millimeter clot can close the middle CV artery.
And did she know about this condition prior?
No.
It was discovered by us or by.
Yeah, it was discovered during the. So when a young patient has a stroke, you go to a laundry list of possible causes, etiologies, and this is one of them. So we studied all of them, and we found this one.
Very interesting. Okay, that's it for me. I think right now. Anything else, guys?
I think that's
good.
That's it.
Well, if we have any questions or anything, we'll contact you. But thank you so much again, and we'll be looking forward to talking to her, the patient, next week. Hopefully she's.
Thank you very much, guys. Sorry for being late.
No.
No, thank
don't
you.
worry about it.
2 interviews in one day, so we really appreciate it. Thank you.
Take care. Bye bye.
Thank you.
Bye.
Have a good
Thank
day.
you.